Hello, I'm DipACLM, a nationally board certified nurse practitioner with specialty certification in lifestyle medicine.
And I'm Susie Spill, a nationally board certified nurse practitioner, also certified in lifestyle medicine.
The following interview was part of a series that informed our presentation at the 2023 Annual Conference of the American College of Lifestyle Medicine, ACLM, titled Nurses in Action, How Nurses Operationalize Lifestyle Medicine in Modern Settings, and You Can Too.
In this series, nurses from diverse backgrounds and practice settings and their champions tell their personal and professional stories about discovering lifestyle medicine and how they're implementing it across a wide range of settings.
Nurses are the largest health profession in the United States and globally and have been voted the most trusted profession here in the U.S. for over 20 years. Learning about and incorporating the pillars of lifestyle medicine fosters full scope of practice and the ability to answer the call to lead by the National Academy of Medicine with their report, Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity.
We hope these stories of success will inspire conversation and drive creative solutions to better address inequities in healthcare. Continued growth of nursing expertise in lifestyle medicine will expedite our nation's ability to address the public health emergency of chronic lifestyle diseases we currently face.
The power of nurses to create innovative solutions when combined with the practice of lifestyle medicine allows nurses to express their full potential while simultaneously addressing the salient issues of health equity, the epidemic of chronic disease, and the provision of truly patient-centered whole person care.
When nurses are empowered to lead with an interdisciplinary and multi-sector practice, they answer the call of the National Academy of Medicine to dissolve barriers to care and improve health for themselves, the nation, and every global citizen. Enjoy the interview. Hello. So today we're speaking with Linda Jackson, a registered nurse and diplomate of the American College of Lifestyle Medicine. She brings her passion for people into her work as a faith community nurse in Westfield, Indiana, where they have a free medical clinic. And after taking the ACLM Reversing Diabetes course, she was really inspired to begin to teach that information to her community about diabetes. And Linda's particularly passionate about helping people prevent, stop, and even reverse type 2 diabetes with a lifestyle first approach. So we're going to hear today all about her practice and this unique setting that she's in and how she's bringing that passion to life. Linda, thank you so much for talking with Deborah and I.
You're welcome.
Why don't we start with a little bit of your story? Can you provide us an overview about your current role that you're doing right now and what your experience has been?
I actually have two different roles at the moment. I'm a faith community nurse at my church, and because diabetes has become my passion in recent years, so far I've taught one class on blood sugar control simplified, and it was about an hour-long class that we held at the church, and it was very well received. And afterwards, people said, "When are you going to do this again? This was really good." And so I was very encouraged by that. So we also do blood pressure checks at the church. I've done the Lift project at the church. So that's one of my hats. My other hat is at the free medical clinic where I'm now paid to be the diabetes educator. We only see uninsured patients, and that's it. And it turns out our population is about 80% Hispanic. Drawback is I speak no Spanish, but we do have interpreters. And I also have a translation device that I can use. We are diagnosing diabetes all the time. It's just a part-time clinic, so we're only open on Wednesday evenings for a few hours every other Saturday. So it's not a bustling business, but we don't have everyone is volunteer pretty much, except a few people on top. And so we don't have the wherewithal to be seeing all kinds of people. We're looking to expand our office. We're running out of room where we are. But so I approached the medical director when I completed ACLM's course and said I'd like to be the diabetes educator. And she said, go for it. So I've been doing that for a couple of years. I meet with people one-on-one. And I've also put together a presentation that I do to a group class. I do that quarterly whenever there's a fifth Saturday, which is coming up. We invite anyone who's been diagnosed with diabetes to come to the class, and I need an interpreter. But so those are my two different hats, what I do at church and then what I do at the free clinic.
Nice. And can you tell us a little bit about the teams? You already hinted at it for the free clinic, but what is your team like in the faith community?
Me and one other faith community nurse, we are it. I'm more active of the two. You have to complete training to do this. It's 18 hours of training, which I completed about 20 years ago. The church I was in at that time was not real receptive and nothing much happened. But now I'm retired. I live in a different place. I'm at a different church. And when I approached the current pastor about having a health ministry at the church, he was very supportive, and they gave me some money in the budget. And that's been a couple of years, about 3 years now. And so we do blood pressure checks, and I brought the Lift Project into the church. There's a Christian edition, which I wasn't aware of through ACLM. They offer the Lift Project, but they have a separate called Christian edition. It looks exactly the same of the videos that you're watching, but the supplementary online material adds some Bible references and different things that would be appropriate in a church setting.
Nice. That's amazing. So you called it a health ministry.
I call it Healthy Journeys. That's the name of my health ministry.
Journeys. That's amazing. So if anybody is listening, or just for us right now, can you describe what the Lift Project is?
Oh boy. It's all online, and it's videos that you watch online, but then there's homework. So you gather as a group, and you can do it as an individual or as a family, but it's great to do it with a group. And ACLM offered that to everyone just a couple of years ago as a bonus of membership. That was pretty cool. I can't speak highly enough of Darren Morton, who this is his brainchild. My first ACLM seminar that I went, not seminar, the annual conference I went to in Orlando, he was one of the speakers. He was my favorite speaker of the whole conference. He's just a very dynamic, enthusiastic guy. And so his videos are very fun to watch. So they're very engaging, hands-on, but he's such a good presenter. But it's more than that. So you see Darren and you get the teaching and you get some supplementary stuff, but then there's other stuff to work on at home. You get more out of it when you dive in deeper. Right. So I highly recommend it.
Yes, I've seen about the Lift Project. I haven't done it myself, but that is more of it's all the lifestyle pillars. Is that correct? Yes.
It is. Like he's from Australia, so I love his accent. And he was instrumental in, I guess he put together the first board exam. He was one of the original doctors chosen to make the questions. So in the US, doctors could become board certified in lifestyle medicine. So it's been his passion for quite some time. And I guess I forgot your question. I'm not sure where.
No, I'm saying that it was a lifestyle. It was a lifestyle. All the
yes,
lifestyle.
He covers. It's very holistic. He covers. Right. He covers everything.
So, how did you get motivated, or how did you find lifestyle medicine? How did you even get to that?
I love to tell this story because it's so unique. One of my daughters was accepted at IU Med School. And when she graduated, before she graduated, you start doing interviews for residency. She wanted to be a family practice doc. And so she had several interviews. She traveled around. And the one we were hoping she would get is here in Indiana, not far from where we live. And so it was at St. Francis in Greenwood. She had her interview there. And during her interview, she asked a question about alternative medical approaches because she's interested in different things and just all kinds of alternative things. And some medical schools are open and some are really not. And she said, I just want to know, how open are you to alternative kinds of things? And the doctor who interviewed her said, the American College of Lifestyle Medicine is bringing their annual conference to Indianapolis this year. And we are hoping that many of our residents will be able to participate this fall. That was the end of that. I always pumped her about how did the interview go. And she said, they told me about this conference. And I said, what is lifestyle medicine? So I went to Google and I typed in lifestyle medicine. I pull up the ACLM website and I'm thinking, this is amazing. I've never heard anything like this. And I knew my daughter would be interested, but I also know residency is a crazy path and who has time to do extra things. So I thought, I'm going to look into this and pass along some tidbits to my daughter that would be helpful because I know she's going to love this. And I found out that it was for me, basically. The more I got into it, the more I was just drawn in. And then I found out that nurses could be part of it as I'm Googling around on the website. And so I sent an email to headquarters and said, I'm a nurse. I'd love to meet other nurses. And I got a message back, where do you live? And I said, I'm in Indiana. Actually, I'm in Westfield, just north of Indianapolis. I'm hoping to go to the conference this year. And the person who wrote back said, you live in Westfield, Indiana? I live in Westfield, Indiana. It was Kelly Freeman.
Really?
It was
Wow.
Kelly Freeman. She lives not more than 10 minutes from my house.
Oh my gosh, that's awesome. Yeah.
And so we met at the conference just in passing. She was busy and but at least I got to meet her face to face for the first time at the conference. And
Right.
she's been very supportive. I'm very thankful for the relationship I have.
Right.
Well, with Kelly for ACLM, she's helped me a lot. But through the faith community nurses, one of our hospital networks, it's called Community Health Network. They pay a nurse practitioner to be their faith health initiative coordinator.
Wow.
And so I got in touch with her, and anything I need, she prints things for me. So between Kelly and the other one is Lisa, those are my two mentors that supply me. I have questions, and it's great having a mentor that's local, not just, I appreciate the MIG meetings when we can meet other nurses, but you're all over the place. And these two are people I can see face to face on a regular basis, and I love it.
Yeah, that's amazing. And Kelly has been integral in bringing nursing into ACLM for sure. And so what year was that? Like, how long ago do you think that was?
2018, 2019.
Okay. And then what were you doing? Tell us just a little bit about your career as a nurse prior to that.
Oh my. For the first 5 years out of nursing school, I worked in hospitals. I kept rotating. We moved a lot. So I worked in several different hospitals, all different departments. I was a new grad. I just wanted to get experience. So I did that for 5 years full time. And then I started having kids and I dropped out of the employee network for a while till my kids got a little older. And when it was time to go back part-time, I did not want to go back in the hospital because you have to work every other weekend. What do you do when your kids are sick? At that point, I had 3 little girls, and I just couldn't bring myself to go back into hospital nursing because of the stress. And I found pediatric home care to be a perfect niche for me because there's such a high demand. You tell them when you're available, and there's families who will take you because they don't have the help they need. They are qualified for nurses and there are not enough nurses. So I jumped into home care, just working like Friday evening for a few hours. And on Saturdays, it fit what I needed with my family at that time. And I ended up doing that for decades. I just retired from pediatric home care.
Oh, nice. And that was, were you able to bring in any of the lifestyle tenets into what you were doing with pediatric home care? As you started to learn more about that, were you able to pull that in at all?
Really, I cut back on my hours in recent years because I qualified for Social Security a few years ago. I didn't have to keep working as many hours. And to be very honest, then I dropped my granddaughter 3.5 years ago. She was born with multiple issues. She needed a trach, she needed a feeding tube, but we never got a genetic diagnosis. She was so medically complex with problems from head to toe. She had open heart surgery, she had a cleft palate repair, she had hip, she had 20 different specialists and geneticists who kept checking her blood, like to see what she matched with, so we know what is this? And what could the future look like? She never matched with anybody, but all my hours for the last 3 years or so was with my granddaughter who lives in Westfield and it takes me 5 minutes to get there. And so my daughter was very influenced by what I was learning. And they recently, her family switched to plant-based predominantly because her husband was diagnosed with prediabetes, getting a little overweight. And so she dipped her toe into plant-based stuff for a while. And after a few months, he went back and got rechecked and his sugar had come back into the normal range. So she just started a plant-based pitch-in once a month in the community just to invite people, whether you're doing it, whether you're just interested. We're going to get together once a month and have a meal together. So I've influenced my family, but not so much through my nursing practice. And then
you are now through the church and through your free clinic, though.
Yes, that's where my time is now.
And so can you tell us, or Deborah, do you have any questions? I know my next foray was going to be asking her about any experiences, anything she could share with us about the free clinic. But is there anything that we should pause and let you jump in to ask? Anything that you think I missed or that we should?
I think that's a great next part. I'd love to share somewhere in there, Linda, if we can explore with you. One of the things we really want to explore with all of our nurses is how they feel empowered to speak to the food and the diet. So Susie was going to pursue, and that'll come into it, but if you can be thinking of that, because that's where you've really not only dug in terms of your practice at the free clinic and in your faith community. And I was reading a little bit about faith community nurses and that certification and whether or not that empowers you more in that respect, just say a case manager or diabetes educator. But I wanted to circle back to say, if you can reflect about all of that as you speak with Susie, you not only did that, but you started creating your own content around that. You saw a need. And that's one of the really exciting things too, is as a nurse, that you're a content creator also in the space of food as medicine. So pretty powerful stuff there. And that you're still when you do this, that you're still wearing that nursing hat, because that's one of the things we hope to come out of this is that our nurses who may be getting pushback from a part of that medical team saying, well, you're not a dietitian. We want to hear from you about what empowers you and informs you. And I was reading and scope of practice when I was looking at the faith nursing website there. So there are principles and all, but yeah, so those are the kinds of things. And Susie, you go ahead.
Yeah, so I was just going to ask you to tell us a little bit more about the work you're doing, especially around being the diabetes educator with the free clinic. If you could speak to that a little bit, what your experience has been, if you have any stories you'd like to share, or how you bring that content in and that kind of thing.
Okay, I want to back up a little bit. Before I went to nursing school, I was taking nutrition classes, and I really wasn't interested in being a nurse. And my very first nutrition class, I had an excellent professor who showed the link between what we eat and how we feel and on getting sick. And for me at age 19 or 20, whatever I was at then, like that never crossed my mind. You just eat because you're hungry. And this nutrition class totally changed my thinking. And then I realized, so I started taking more, and I was very practical. I wanted to be sure I got a job as soon as I graduated. And at that time, we're talking 50 years ago, if you graduated with a degree in nutrition, you became like a dietitian at a hospital. And I didn't want to do that. But from that early on, I really wanted to, knowing the link between nutrition and health, that's what I wanted to do. And I ended up in nursing, always wanting to be more on the promoting health side than in taking care of sick people. That's really where my heart was. There was no money in doing that. So I took care of the sick people for quite a while. But that seed had been planted way back with that first nutrition course. And so we ate healthier when we grew up, not when I grew up on Wonder Bread and Skippy peanut butter and Smucker's jam and Twinkies in the lunch at school and all of that. That's how I grew up. But I married a man who became a chiropractor, and he learned about nutrition in chiropractic school. And so we didn't have white sugar or white flour or that kind of stuff in our house. So our kids were raised very alternatively back in the 70s and 80s, because we didn't, for a birthday treat, they got Kraft macaroni and cheese, because that was the one time I let them splurge with turkey hot dogs. So we ate healthy, but what I've learned with lifestyle medicine has taken healthy to a whole different level than where I was before.
And what does that
So
mean for
then,
you? Healthy at a whole new level. What does that mean for you or for your patients?
oh my goodness, there was a lot more to it. I didn't know anything about phytochemicals. I didn't know that the food you eat can affect your mental health. Really? That if you eat better, your depression, your anxiety, that was all new to me. What a big impact. Like I knew you would be healthier. I don't know. I guess it's just the that lifestyle medicine has an added dimension. It's not just nutrition, basically. So this is nutrition plus, because it adds moving more and dealing with your stress and getting good sleep. And I hadn't put that package together. ACLM did that for me. And so that's a whole new level that I'm talking about.
Right. Yes. Yes. Thank you for that.
On the free clinic, diabetes is epidemic in our country, and we see people who are mainly from other countries are here sometimes even without identification, trying to make ends meet as best they can. They don't have insurance, and they're not eating healthy. And when we see, our medical director, her policy is everyone gets, if you came in with an earache or knee pain, it doesn't matter what you've come in for. Anyone we see as a new patient gets a complete metabolic profile, gets an A1C test, gets a lipid panel. That's standard for everybody we see. And because of that, we are diagnosing diabetes right and left. Everyone gets an A1C and hardly anyone's normal. Hardly anyone's normal. And that's just in this population, but it's true across the board in the US, the way all the processed food that we're eating. It concerned me that so many, this is devastating. People don't feel sick when they have diabetes. What? I have diabetes? I don't feel bad. And some of them don't even want to take the medicine because I don't feel bad. It's not a problem. Yeah, you may not feel bad, but it really is a problem. It puts you at risk for heart disease and other things. And you don't want to
So
go there. And
in
then you
that,
definitely, go ahead.
okay. I would say in that setting, the people that you're working with, if they're a vulnerable population, do you have to start like at the very beginning with even what diabetes is, how it affects your body, why it's important? You have to start from the basics, or is it different?
Yes, because our providers are old school, and when you leave, they tell you there's a lot of sugar and fruit, so don't eat too much fruit.
Yes.
And I heard
Is
one of
that
them
what you
say,
mean?
eat more meat, is one of the other providers said. And I was like, oh no, you didn't just say that.
Right. So that's what you
I
mean
was
by old school, right? Like maybe people aren't as up to date with the
yes.
newer understanding of diabetes. Is that what you're saying?
Yes, because we have volunteers, and the volunteers are people in retirement for the most part. And they were trained like I was many decades ago. And that's what they were told decades ago. And they don't know what the new research shows. So that motivated me to keep it really simple. And one of the first handouts I made was 7 suggestions for improving blood sugar control. Really simple. And I got it in English and in Spanish. And then many of them have hypertension. So I have 6 tips for controlling hypertension. And one by one, I started building. But diabetes became my passion after taking that ACLM extra online class, realizing people don't understand what it is. They don't feel sick, they don't understand what it is. What that has all culminated in is I came up with a 3D model of insulin resistance, which is very unique. It uses a little toy bulldozer and some pop beads for sugar molecules and empty baby food jars turned on their sides that are muscle cells. And I showed it to some people. I show this in my class. I've showed it to some individuals. And I really believe they have an aha moment. You can explain in words what insulin resistance is. When you see it, then you understand it a lot better. And so I had really good feedback on this. So I approached the local high school and got some students to film this for me. And I now have a YouTube video. And in 9 minutes, I cover head to tail of what diabetes is and why it's a problem and what insulin resistance looks like, and very simple things that anybody can do. And YouTube has the option of Spanish subtitles. So although I I was speaking in English, anyone can go on YouTube who speaks Spanish and click the Spanish subtitles and get all the information.
That's amazing. Yes, I watched your little video. It was good. It was really good. I love that, because having the visual, that's another way to learn something other than just hearing it. So it
Yes.
just really solidifies it. So that's amazing. So I'm guessing some of the things that you use with your patients, the handouts, the video, how can you describe to us like your process for them being able to create behavior change in their lives? Any success story or how you help people do that?
I'm hoping to have more success stories because it seems like what I've seen so far is not the results I was hoping for. And it's just recently that I've been using this model, which I think makes it more real to people. So I'm hopeful within 6 months. Actually, my goal is once a year, we have a fundraising campaign in November, and I would love to have one of our patients speak to, here's where I was when I came into the clinic, and here's where I am now, and all I did was lifestyle change. That is what I'm shooting for. I was hoping we would have that by this November. It may not be, but when I was going through some charts recently, one of the women I had seen, because she was pre-diabetic, and I saw her because she was pre-diabetic, but her bigger problem was hypertension. And when she first came into sin, she didn't know her blood pressure, I forget, was like 160/90 or something like that. And they put her on hypertensive medications. Two of them, actually. First, there was just one, and she had some side effects, and it brought her pressure down. But she didn't like the side effects, so she just stopped taking it, didn't tell anybody. She comes back in for her next clinic visit. Her blood pressure's up again. Oh, let's try this other medicine. So she tried it. Her blood pressure came down, and she didn't like the side effects, and she went off. And she talked to me at that point, and I said, don't just stop taking the medicine. You need to talk to the doctor, tell them, explain their side effects. I talked to her about lifestyle because of the diabetes. I said, tell her all the things you're doing, keep checking her blood pressure at home. But she just stopped. And I didn't see her for a few months. And I happened to be working at the clinic when she came in for her next checkup. And I was the one who admitted her, did her vital signs, and her blood pressure was 120/70. And I said, so when did you stop medicine? And it was like 2 months before. So she had been on 2 different medications for blood pressure that she stopped because of the side effects. And lo and behold, unfortunately, her A1C was still like between 5.9, 6.1. So the sugar problem wasn't resolved, but it hadn't gotten worse, and her blood pressure had gotten significantly better. And so I asked her, what are you doing? And I'm walking more. She was just doing some really simple things, not eating fast food as much, just, not very much really, but it made all the difference for her blood pressure. So that was very encouraging to me. That's
And
my best success story so far. It's not
yeah,
a sugar success story, but I'll take blood pressure success.
but you know what? Every little bit counts.
And that's why I love lifestyle medicine, because the very same healthy choices that will bring your sugar down, will bring your blood pressure down, will bring your weight down, will bring your lipid panel down. It's the very same choices.
Right, because
And seeing that, I guess that brings me to one of the other content things I created that I'm very excited about. So I first saw on the ACLM site, there's a resource for lipid panel, and it's a bar graph, and it's just your 4 basic cholesterol, triglyceride, HDL, LDL, but it's all color coded in green, yellow, and red. And I use this regularly at the clinic. So I made my own color coded for A1C and sugar, because people check their sugars at home, but they don't have no idea how A1C corresponds to that. So in one bar graph, that's red for diabetes, yellow for prediabetes, and green for healthy range, I have the bar graph coded on one top side with A1C number and a corresponding blood sugar number. So when people are home and they check their sugar, they can, because your doctor just talks about A1C and that doesn't mean anything to anybody.
That's
I and,
amazing.
and then I saw the American Heart Association has a color coded blood pressure where green is healthy, going up to red being danger. So the 5 different metrics I came up with that I realized, oh, we already have information, a visual that makes it really simple. Numbers are hard to process. Colors, red, yellow, green, that's very understandable. So putting those metrics together with ACLM already had green, yellow, red foods. On one of their extra classes you can take, there's a presentation. Here's what green foods are. Here's what yellow foods are. You should eat mostly green foods, yellow foods in minimally, and try to stay away from the red foods. So ACLM already had that. And I thought, what if it's got packaged all together? And so I submitted my idea through the channels. There's an incubation, whatever, and it sits in the incubation stage and it works its way slowly up to the top. And this took months, but about a month ago, I got a call from Caitlin Pauley that said, your thing finally came to the top and our committee voted unanimously to proceed with this. And I shared
That's
this with
amazing.
Deborah back at the last conference. I've shared it with Joanne Evans. I've shared it with Kelly, and they all love it. But it wasn't going where I had hoped it would go because I thought it was a very creative idea that made it really simple. My ideas are try to keep it simple and understandable for the average person. And red, yellow, green does that really well. So Caitlin wrote, she first emailed and she said, this is a fantastic idea. We just love it. We're preparing for the conference, all hands on deck to get all the materials we need right now for the conference. But we should be able to have this in finished form by the end of the year is the goal. So I'm very excited about that because I use that regularly when people see where their A1C is, where their blood pressure is, where their lipids are even. Because the lipid panel, in my experience, is always off. If your sugar is up, your lipids are off. Of course, because of the fat being the problem in diabetes, that people think sugar is the problem and they don't understand that fat is the problem.
Right. And so the things that are on that handout or will be on that handout are the lipids, it's the A1C.
It's lipids, it's A1C, it's waist circumference, it's blood pressure, and BMI. There's a BMI chart that's in, so those are the 5 metrics.
Okay, that's amazing. Yeah. And that'll be nice to have a visual. So, well, I'll be looking forward to that handout for sure. So that's awesome. The content creation, finding a need and then just keeping it simple. I hear that over and over, the keeping it simple part, because people can feel very overwhelmed. So that's really amazing. I do want to ask you, and maybe Deborah, I don't know if you have any questions to jump in with, but I do want to ask you, what do you think some of the key challenges are in that free clinic for you in order to move it along the way that you want to see the results that you want to see? What are some of the key challenges?
Getting the providers on board, really. So here's what's happening, because I've talked to the executive director and she loves what I'm doing and would like to see more of it, but we have to convince the medical people who were trained years ago. My executive director invited Kelly Freeman to do the in-service for our medical volunteer staff, doctors and nurses. So I think in September, Kelly is doing, we have in-services from time to time. And so without me even knowing that this was happening, Kelly's been invited to speak to the medical staff on lifestyle. So I think that could help move things in there. That's where it needs to start, because they are still, before I started as diabetes educator, they had what they called their diabetes education booklet. And it's so old school. It's counting calories and it's all this, it's hard. It's just, it doesn't, and whoever put it together had great intentions and picked handouts that were both in English and Spanish, because we need mostly Spanish. There was not a lot available in Spanish, but all the old school stuff was in Spanish. And they call it the orange notebook, and I hate the orange notebook. And I'm hoping after Kelly speaks, that's going to be in the past, and we're going to be able, because I told the executive director, when I meet with people one-on-one or in a group, I am telling them something different than what they're hearing from their provider. And that's a big problem. She said, I
Right.
understand, be patient, it's going to take time. So
Right.
that's really where the hangup is. If I could get the other medical professionals on board and talk about this, instead
Right.
of watch your fruit and eat more meat, or just watch your carbs. Like, they don't even know, what does that mean, watch your carbs? But
Yes.
we're busy, and it's, we see a lot of people, and providers don't have more than 10 or 15 minutes, just even outside of our clinic. It's
Right.
same kind of thing. We schedule people every 15, 20 minutes. So there's not time, but that's why I've got the time. But I just don't want people to be thrown off by what they hear from the doctor and then what they hear from me, because it's contradictory. I met with someone the other day. I said, eat at least 2 pieces of fruit a day. 3 pieces would be better. Leave the skin on if you can. Oh, the doctor said I should watch fruit. I said, yes, there's sugar in it, but there's also fiber, and fiber is what we need, and fruit's got it. And so please eat more fruit. So
Yeah.
that's really a challenge, is what I'm saying is
Right.
different than what they're hearing from people who have higher credentials than I have.
Right.
Seriously, I'm just a bachelor's degree nurse, but I
Well,
passed that exam, and so I'm a lifestyle medicine practitioner.
this might be a wonderful time to have Deborah chime in with the information about even Florence Nightingale. Years and years ago, talked about water and air and nutrition. So all of that kind of stuff. But I hear what you're saying about the not having a conflicting message and
Mhm.
people having a message that is more consistent with health promotion. And then anything on the patient or family side that you think could be obstacles? Sometimes I hear time or money or lack of knowledge
Um,
could be one, but
I always ask for a spouse or significant other to come if it's just pointless to talk to one person. It really is. And they might understand it and get it. And I always do social determinants of health when I first meet with them one-on-one, and find out, like, I ask, where do your groceries come from? Rather than what store do you buy your groceries at? Social determinants of health is so important, because you can give them all the great information, but it may not match what they're able to do. So understanding the environment, who they live with, where do their groceries come from? It might come from a food bank, and you don't have a lot of choices when it comes from a food bank. So I'm careful in how I word. Instead of where do you do your grocery shopping, where do your groceries come from? So it's okay for them to say from a food bank. How many people are in the household, and who does the cooking? Who does, who chooses the groceries and who does the cooking? And asking then specific questions about what does breakfast look like, and etc. But understanding they are they people who don't even have ID are working jobs that they don't get paid much for. And so money is definitely an issue. But I try to point out, and most of them are still eating meat, and everything's more expensive now. And people complain now it's so expensive to eat plant-based. I actually think it's cheaper to eat plant-based, especially now. The price of Mexican, Venezuelan, that would be our predominant Hispanic population from there. That beans and rice, you can live on beans and rice. And I talk about the blue zones, the people in Costa Rica who are eating the way they've eaten for probably not much anymore because of the way things go. But 10 years ago, when they did the blue zones research, and people were still eating like they had for generations. Just make your own tortillas and beans and rice. You can eat really simple. It's not expensive. And so I try to emphasize that part of it, because but they're busy and they have families too, and the teenagers aren't going to eat this, and there's a lot of, it's hard.
yeah,
It's just hard.
right. It is hard. I would like for Deborah to bring in some information about our future of nursing. There's the report from the National Academies of Medicine, Future of Nursing 2020-2030, has a very urgent call to nurses to address some of exactly what you're talking about. Deborah, I'm going to hand it over to you. to take over as far as that goes, whether you want to read the quote or just some questions about that.
Okay, thank you, Susie. Linda, I want to reflect on your sensitivity in inquiring also about those social determinants in health, and how you are specifically asked not where do you buy your groceries, but where do your groceries come from? Where does your food come from? Those kind of subtleties are so key in giving our patients, our community. Our patients can be, as it is in the code, it can be one person, a family, a community, the world, and that's the nursing patient. And you ask with that sensitivity that gives that person permission to be honest with you and to forthright, so that they can share and you can assess them better. And assessment is one of the key aspects of the nursing process. And there you are. Where Susie and I are very much interested in your thoughts about the intersection between lifestyle medicine, lifestyle nursing, as you are so vibrantly involved in your community in several settings. And the National Academy of Medicine's report, it's called The Future of Nursing 2020 to 2030, Charting a Path to Achieve Health Equity. And it's focused exactly on what you're speaking to there, which are the social determinants of health and health disparity. So wanted to ask your thoughts on how we as lifestyle medicine educated nurses can lend our particular insights, education, experience, and passion to this effort. And just read a brief quote here from it. Nurses are trusted bridge builders who champion good health for all. The Future of Nursing 2020-2030 report explores how we can and must unleash the power of the nurse to achieve health equity, and how the systems nurses function within must do more to educate, pay, employ, and enable nurses to support them so they can do more. Linda, with all of your thought about so many things in your creative work, can you share with us some of your impressions thinking about that in your body of work and your passion?
I think I'm going to go back to what I said about where do your groceries come from. Another way to be sensitive, and I talked to ACLM about this when they make their color charts. I don't want the BMI chart to say obesity. People don't want to be told that they're fat. So when these charts come out, I'm suggesting that for the yellow zone, across the board, they just call it at risk, at moderate risk for chronic disease, and the red zone would be at high risk for chronic disease, rather than you are obese. And the terminology really makes a difference. And so I'm hoping they will take that into consideration when they make these handouts, because people don't, like we said at the beginning, people don't feel sick, and you do the labs and we see trouble. They don't feel like there's trouble, and their life is fine the way it is. So I guess it's just being sensitive, as we've talked about. I don't know how to elaborate more than just understanding their unique situation. It's not that I have knowledge that I'm sharing with you. It's more, let me understand where you're coming from, because then I can tailor my recommendations. What do you eat for breakfast? Have you ever tried oatmeal? I'm not going to push oatmeal on them, which is very healthy, if they've never eaten it or don't even want to try it. Just across the board, understanding where they're coming from, you start there. You don't start with the education. You start with where they're coming from. I guess that's the best answer I can give you.
And Linda, you're touching on something really key, which is the nursing process, nursing assessment, meeting someone where they are, honoring that each person as an individual, the whole person, that person in the context of their culture, their background, their family, their history.
Right.
And that is the art. We have lots of science as nurses, but that is also the art of nursing, but it is the nursing process. What would help you if we talk about literally the National Academy's Robert Wood Johnson saying nurses are the solution to standing this up, and here we are in lifestyle medicine as nurses with the tools and the knowledge that we didn't have at one time in our nursing career, even though our art and science of nursing are really founded in Florence Nightingale, environmental theory, all of this is science also. But where would you see, if you had a magic wand and you could say, here are some things I'd love to see for nurses, or that I would say if I had a big microphone or megaphone to talk to all the nurses out there, those nurses at the bedside in the hospital, the nurses that are rooming the patient with the BMI of 40 or the blood pressure of 160/95. What would you say to these nurses about not only this area of lifestyle medicine, which really the lifestyle pillars are right in our code of ethics, which is really beautiful to me, but also about authority and practice as a nurse to speak to our patients to these effects, to inquire, to assess, and then also to educate. What would your words to other nurses and nurse educators and policymakers about this for nurses?
It's a time issue. I can't even relate to being at the bedside now. I know what it was before, and I can't even imagine what it is now. But it's so important to see each person as an individual, even with the time issue, to try to get a feel for what's important to them. And it's different for everybody. So it's being a good listener, I think, is asking good questions and being a good listener and following up with that. And it takes time. It's not something that happens in 5 minutes. It happens even just repeated over a period of time. And they mentioned about someone in the family. You ask how that other family member is doing. They're coming for something else, but that's what was important to them the last time you talked about it. So they feel like somebody understands and cares. And then they're more open to what you have to say. I don't know how to say it aside from that, really.
I would say I totally that people want to be seen and heard. We all do, not just.
And the quote is, people don't care how much until they know how much you care, is what comes to mind. One of my goals has been the part of the FCN curriculum is health promotion. That's one of the modules. It's called health promotion. It is abysmal. So I took it 20 years ago when I didn't know really anything about health promotion. And it's been revised and updated every 5 years. They update it. 24 is the next time it's going to be updated. They're asking right now for feedback on updating their syllabus. And it's abysmal. There is nothing about lifestyle in the health promotion module. Nothing. It's a bunch of blah, 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 blah. Boring. It really is. And so my big goal, and has been, like Kelly, I told this to Kelly a while ago, my goal is to see that curriculum modified, because there isn't time in the workspace, but there's time at church. There's a whole different dynamic at church. And if we can bring the health promotion into a church setting where you don't have the time and money factors involved and you already have relationships, that's my goal. So I'm hoping that the feedback they get for the 24 is going to incorporate lifestyle, because they have to. It just drives me crazy when I look at the way that module is written. They'll talk about healthy people 2030 and what the goals are. But they're not talking about lifestyle. So what's the word I want? Academician. It's people who are paid to have these high roles to roll out a curriculum, and they're just not living in the real world. And we've got to make health promotion practical, which is what lifestyle medicine does.
It sounds like you will be a great resource for them.
Yes, Susie. I was going to also follow up to ask you, since we're here together, Linda, other ways that you might be able to be supported in doing so, any other things that would assist you on this mission, because that faith-based manual that you're talking about, curriculum, will impact however many faith-based nurses are out there. That sounds like a Very, very important.
So here's what we're doing at the local level, because my other mentor in the Nurse Practitioner and Community Health Network, she's responsible for teaching the class. So I took it 20 years ago and I upgraded. So I took one of her recent classes so I could be up to date. And then after I did that, she asked me to teach the health promotion module the next time she had a group come through. So that was my privilege to do a couple of years ago. She's next doing it this coming October is the next cohort. And she's invited Kelly Freeman to teach the health promotion module. So I couldn't be happier. And so I'm hoping that Kelly, because of her credentials and who she is with ACLM, that we can get more of an inroads with whoever is on top and makes these decisions, because we're just totally missing the boat. And health promotion module is just a small part of this entire curriculum. It really is a very small part of it, but it's such an important piece and we got to get it right. And Kelly and my other nurse friend, Lisa, they are supportive of me and trying to push this through. And because I just feel strongly that churches are a place where this can happen more than it can't happen in an office.
Yeah, so true. I agree with you. You have shared a lot with us today, a lot for us to think about and a lot for other nurses to consider as well. Is there anything else that you feel we left out or that you would want to share about your experience or lifestyle medicine in nursing, anything like that?
That ACLM is the best foundation. It's worth studying to be certified, but and there's so much on the ACLM website, it's a little bit overwhelming the way it's grown exponentially, but there's so many great resources. And I guess I feel ACLM empowers me. And I feel like I have this team behind me. I have all the science behind me, and just joining the Nurses MIG and learning from other nurses is really helpful. And we all have our different niches. Everyone's doing a little bit different thing, but I just find it really empowering to be part of that organization.
Yes, I agree. And I know Deborah agrees too. It's where I think we probably both have found our home. When I first went, my first conference, I didn't even know what lifestyle medicine was. And I just went and I thought, oh my gosh, these are my people.
Yeah.
Why didn't I find them before now? I too echo what you just said about the support of the ACLM and all the information and resources, the ways that they support us and that we support each other within the American College of Lifestyle Medicine. Really important, I think. So thank you.
And I've thought about
Any
being a
last
health
words,
coach.
Deborah?
I have not taken health coach training, and I think I feel more empowered just as a nurse. Like health coaching would be great if I could add that to my resume, but I don't need to. I feel like I know enough as a nurse, and there's only so many hours in the day. That's a whole nother thing, but I can make a difference as a nurse without being a health coach. But the ACLM has made that possible, especially for me with the diabetes thing, having gone through that extra, whatever they call CMEs that you can get for taking this other class. You don't need more than that. You are a diabetes educator. You have the science to back you up. And it's empowering. I keep saying the same thing over and over again, I think, but.
No, I took the course too. It's amazing. It's phenomenal. It is a phenomenal course.
Yeah.
So,
and one of the things we always love to know are about what empowers you, and you've just shared it so clearly and so passionately, the resources that what informs you as a nurse and empowers you to go out and educate on diabetes and blood pressure, paint the picture, educate your patients about how it all comes together, is that you have your training as a nurse with your skills in assessment and your science background in treating these things from the nursing perspective, informed by the science that's ever growing and the resources that's ever growing out of American College of Lifestyle Medicine, so that you walk out and I feel like what we hear you saying is that gives you the confidence to be very clear with your patients, and what our patients are really and our community are really yearning for is clarity. There's so much confusion out there. Someone's telling them Atkins, someone's telling them keto, someone else is telling them that. But when you walk into a room and you're doing one of the shared medical visits that you do, you said when there's a longer month, or in your one-on-ones, or in your faith community, you are speaking with the confidence and the clarity that allows you to be explained
Exactly.
those simple terms to your patients. And that is some of what really, that is what gives you your power, your superpower, because you have that with your patients to explain, to knowing yourself, and to then also explain to your patients and answer their questions and be really clear so that you're not thrown off course when they ask it, and you know how to empower them.
And with diabetes in particular, I get angry about the number of doctors who are promoting keto and going on YouTube and saying so many people got better and this keto and it just makes me angry because it's just not true. They're making a lot of money. And that was motivation too. Like, we've got to get the truth out there. But they make it sound scientific. And so people are confused because they're hearing opposite things. And how do you know? That's why building up the trust of the patient and then assuring them that this is scientifically based. And when they see, you can't believe that keto is good after you've seen my demonstration of fat that's inside muscle cells. Like, you'll realize that may help people in the short term. It's terrible for your heart in the long term, but people don't see that. So yeah, I got this keto stuff for diabetes really got me riled up because so many people are buying into that. And some doctors are making a lot of money on it. And it's very aggravating.
Yeah. So you're using the power of relationship and understanding, and then the power of the science and keeping it simple, and the tools and your clarity on that. And
Yep.
those cotton balls in those jars on your demonstration, once someone sees that's okay, I get that. How do we make it really clear? It's a beautiful video, and we'll make sure that everyone gets the link for that too. It's been an amazing conversation with you as a nurse practicing in several areas, in the clinic, in the free clinic, and in the faith community. And here you are developing content for ACLM as you speak to the power of the content that's already there and develop your own. So that is for us to all benefit from. So thank you.
Yeah.
You're welcome. I love it. I just love doing this.
Yes, and I thank you as well. And I echo everything Deborah said, and I really appreciate your time spending this space and time with us so we can learn a little bit about you and your practice and share it with others who are trying to make their way in the lifestyle medicine world as well. So
Yep,
thank
they
you.
can do it. If I can do it after all these years.
That's Susie. I was going to ask one last, somewhat like the countdown, where I just say, do you have a final message for all those nurses out there to cheer them on in doing this as you're doing, feeling empowered? Do you have a final message for those nurses to let them know, yes, they can, that they are empowered to do this also, to share this education with their.
I don't know how to say it more than what I already did, but I'm going to sneak in something here which doesn't answer your question. I am super blessed. My primary care provider, who I saw this morning for my annual wellness visit, is Jenny Shull Clayton. Jenny's a fellow of ACLM. Jenny she and John Kelly put together the very first manual to study for the board exam. She just was part of the 4th revision for the board exam. She's a new mom with a 3-month-old. She told me she's cut back her practice to part-time, but I got to see her this morning. And she's just in the next town over. So it's just a huge blessing for me to be here and have the support that I have. And even my PCP. Oh my goodness, this is awesome.
You're surrounded by
Yes,
these
it's amazing.
leaders. Yes, it is. Yeah.
Yes. All right. Very good. Thank you again, Linda.